As the world awaits the mass rollout of coronavirus vaccination campaigns, America still faces a long winter, and as cases surge, the growing challenge of curbing the spread of the virus. In November, it still looked like the US and Europe were on the same trajectory, with cases spiraling upward. But tightened restrictions in Europe appear to have tamed the second wave of the virus, at least as of early December. Despite being credited for the drop in cases, the second national lockdowns that were reluctantly imposed in much of Europe have not found favor in the Trump White House or the incoming Biden administration.
Europe imposed draconian lockdowns and cases were surging and deaths were surging. But think of it, draconian, now they have to do it all over again. What the hell are they doing? I think I'm going to go over and explain it to them.
Because every region, every area, every community can be different. And so there's no circumstance which I can see would require a total national shutdown.
But what does Europe's coronavirus response actually look like? I'm Rick Noack in Berlin. It's the first week of December, more than 1 month into Germany's partial nationwide lockdown. But here on the Friedrichstraße, one of Berlin's busy shopping streets, you can't always tell. Stores like this one are still open, and the sidewalks are crowded with people, though fewer than usual. There are some signs, of course, that things aren't normal. It's mandatory to wear masks in many crowded outdoor areas. Restaurants are takeout only, and hotels are only allowed to accommodate business travelers.
Some parts of Europe, like Spain's Canary Islands or Finland, had even more relaxed policies in place in November, thanks to relatively low case numbers. But the vast majority of regions imposed much harsher measures as cases mounted. The streets of Paris looked eerily quiet throughout November, evoking images from spring when European capitals locked down for weeks. Those restrictions halted a rapid surge in cases in spring, especially in the worst-hit nations of Italy, Spain, the UK, and France, and allowed Europe to return to a degree of normality over the summer.
But this time around, the response, even though similar in practice, feels different on the ground.
Schade, dass die Restaurants nicht aufhaben. Das fehlt natürlich ein bisschen. Mal einen Kaffee zu trinken oder so, das fehlt. Ja, leider. Aber wir müssen da durch.
Der Krise, auch der kulturellen und wirtschaftlichen Verluste, wird man erst im nächsten Jahr spüren. Und da gibt es natürlich ein böses Erwachen. Ja. Deshalb ist es wichtig, dass wir uns an die Maskenpflicht halten und Abstand halten.
In many countries, schools are still open as of early December, and Britain, Germany, and France have appeared eager to relax restrictions before or during the Christmas period. Public fatigue, widespread anti-lockdown protests, and dire economic forecasts have played a role in shaping those more lenient approaches. Even though politicians are increasingly under pressure to take economic and political demands more into account, scientists like Tobias Kurz say that European leaders have mostly offered science-based advice, in contrast to President Trump, who's often contradicted his top virologists. What would you say are the most striking sort of differences between the US response and the European response to this virus?
Well, there is a clear difference in terms of realizing that there is a problem and then trying to really react, trying to test the population, trace, and then isolate if necessary. In the US, often the problem, I wouldn't say was ignored, but certainly not as taken as serious as European countries did take this serious, and then inform the population that actions are necessary. Of course, there are downsides, economic consequences, psychological consequences. If people stay home, that's not easy, and now during the winter, it's getting really tough for some people.
But for some European countries, simply following the science just wasn't enough to avoid disaster.
One key difference has been the state of healthcare systems. Hard-hit nations like Italy, Spain, and the UK had relatively few acute care hospital beds per capita in the years before the pandemic, whereas nations like Germany and Austria have for decades had a large excess capacity.
Lagging testing capacity has been more pronounced in some countries than others. And intergenerational living, which is particularly common in Europe's south, has added another challenge. And perhaps some nations just were a bit luckier than others.
Sweden, for example, initially fared better than Italy or Spain, even though it didn't lock down at all. And Central European countries were quick to close borders in spring, helping them to escape the worst. The Czech capital of Prague even hosted a massive dinner party this summer to celebrate having beaten back the first wave. But in recent weeks, both the Czech Republic and Sweden have seen cases and deaths surge. The Czech Republic at some point reached a higher death rate than almost any other country in the world before cases began to decline again.
That's also important to understand that if something works in one country, it does not necessarily work in another country because the settings are so different.
So there aren't necessarily any broad lessons that you can just apply to another country here?
Well, broad lessons are to take the virus serious, to understand that some people get sick, severely sick, some people die, and that one should react depending on the local setting, depending on the healthcare system, depending on the availabilities of ICU beds and other measures.
Meanwhile, here in Germany, cases have been falling less rapidly than the government had hoped, which has triggered warnings that the porous lockdown now in place could be the new normal for some time to come.
Even the rollout of vaccines won't change that, German Chancellor Angela Merkel and other leaders have warned. Germany's already constructing large-scale vaccination hubs in sports arenas, exhibition halls, and other venues across the country. But it could take until late 2021 for everyone to be vaccinated. In the meantime, the threat of another surge in cases in Europe looms large.